When your gums bleed, do you think that's normal? Most people do. They've been told it's because they don't floss enough. Maybe they brush too hard. But bleeding gums are a sign. Your immune system is responding to bacteria, and that response doesn't stop at your gums. A recent study published in Frontiers in Immunology looked at what actually happens when you have gum disease. I want to walk you through those findings. Gum disease comes in two forms: gingivitis and periodontitis. Both are triggered by bacteria, but they're different. Gingivitis causes inflammation, red, swollen, bleeding gums. It doesn't destroy bone or connective tissue. It's reversible. Periodontitis destroys the attachment between your gums and your teeth. It eats away at the bone holding your teeth in place. Once that bone is gone, it doesn't come back on its own. Here's what surprises people. The bacteria don't destroy your bone. Your immune system does. That's one of the key findings on this research. Your gums are lined with epithelial cells, a protective barrier. When bacteria invade, they break down that barrier. They degrade the connections between cells. They trigger cell death. Once that barrier breaks, the bacteria flood in. The study found that in advanced periodontitis, you lose healthy epithelial cells. You gain inflammatory ones, cells calling in the immune system. Bacteria like Porphyromonas gingivalis, one of the most aggressive periodontal pathogens, don't just damage tissue directly. They manipulate your immune cells to produce pro-inflammatory molecules that keep the destruction going. Your body tries to protect you. In the process, it tears itself apart. Your gums are full of immune cells, fibroblasts, neutrophils, macrophages, T cells, B cells. In a healthy mouth, these cells maintain the balance. They fight infection, they repair tissue. In periodontitis, that balance collapses. Neutrophils are your first responders. They're essential for controlling bacteria. But when they are overreactive or when they don't get cleared out, they release molecules that promote tissue destruction. It's not that neutrophils are bad, it's that the balance is broken. Too few, bacteria win. Periodontitis accelerates. Too many, tissue destruction, chronic inflammation. Your body needs the right amount at the right time. The researchers used advanced gene sequencing to study these immune cells. Some immune cells are programmed to fight. They break down infected tissue and signal bone to dissolve. Other immune cells are programmed to heal. They calm inflammation and help tissue to rebuild. In a healthy mouth, you have both types working in balance. In periodontitis, the fighters outnumber the healers. In chronic periodontitis, the inflammatory cells win. Normally, bone is constantly remodeled. Some cells breaking down, other cells build it back up. Inflammation disrupts that cycle. The study showed that in periodontitis, inflammatory signals turn on a pathway in bone cells. This triggers two things. One, it increases production of a signal molecule that tells bone-destroying cells to ramp up activity. Number two, it blocks bone-building cells from doing their jobs. So even after bone is destroyed, it doesn't get rebuilt. That's why periodontal bone loss expands. It's reabsorption without repair. Your body is stuck in destruction mode, and the inflammation doesn't stay local. It becomes systemic. The researchers reviewed how periodontitis has been linked to diabetes, rheumatoid arthritis, cardiovascular disease, Alzheimer's disease, and preterm birth. Why? When bacteria break through your gum barrier, they enter your bloodstream. This triggers systemic inflammation. In diabetes, gum inflammation makes it harder to control blood sugar. Clinical studies show that treating periodontitis improves glycemic control. The same bacteria damaging your gums can trigger autoimmune responses in your joints. Bacteria from your mouth can contribute to plaque buildup in your arteries. There is growing evidence that oral bacteria can contribute to brain inflammation in Alzheimer's. Pregnant women with periodontitis have higher risk of delivering early. Your immune system responds to the bacteria, but in doing so, it affects distant organs: your heart, your brain, your joints, your pancreas. Your mouth is not separate from your body. If you have chronic gum disease, you're carrying a burden of inflammation that affects everything. This is not about brushing harder. It's about breaking the inflammatory cycle. That means professional treatment to remove bacteria and infected tissue, restoring balance in your oral microbiome, addressing systemic factors like diabetes, smoking, or nutrient deficiencies. Sometimes it requires surgical intervention to remove infected bone or regenerate what's being lost. Periodontitis is an immune problem, a bone problem, a systemic problem. The earlier you address it, the more you preserve. If your gums are bleeding, don't ignore it. If you've been told you have gum disease, or if you've been noticed bleeding, swelling, or loose teeth, contact us. We'll check for bone loss. We'll see how your gums might be affected the rest of the body. The mouth is the mirror of your health. What happens there doesn't stay there.